Hi, welcome to this update. My name's Mike, and this is the next video in my series regarding my aortic valve replacement surgery. Today is the 28th of October, and it's a week since my operation. So I'll pick up where I left off on the last video. So when you last saw me, I was just getting ready for surgery that day. I was prepared by the nurses to go down to the surgery, to the theatre, and I was taken down to the anaesthetic room. They basically got me on the table, started putting lines and sensors on my chest and getting me prepped up in that way. And after about 10 or 15 minutes, they introduced the first of the drugs into me to put me into sleep mode. And very quickly I felt drowsy, and I don't recall anything after that. I think they must obviously continue working on you, putting in the neck drip lines and all the other various stuff they put on you. The next thing I remember is being brought around in the ICU. I wasn't aware of any pain. I felt really groggy, disorientated. After a brief time, I was given some water to drink, but as a result of the anaesthetic, I wasn't able to keep it down. I vomited that water up, which they did say was quite normal, a reaction to the anaesthetic, the drugs that they put into me. I pretty much drifted in and out of sleep all evening. That would be on the 21st of October, and then on the Sunday, the 22nd of October, they got me out of bed and into a chair, which is apparently what they do. They want you up and out of bed as soon as possible. They want you upright. They want the chest drain. They put a drain in your chest. They want that doing the job of draining any fluids that have built up in there overnight. So having you upright in a chair helps with that. They brought me some water, had a little bit of a drink, and then they brought me a cup of tea, which I also drank, and then I was sick again. After I'd just had my medication, and I was sick again, and probably threw up about 300-400 millilitres of fluids that I'd taken in, and yeah, it wasn't very pleasant. Probably not pleasant for the staff either. They gave me some anti-sickness medication at that point, and then I ate some breakfast. I had some toast and cereals, and thankfully I was able to keep that down. So on the first day, I was seen by the physiotherapist and the doctor, who basically told me what would happen over the next few days. So obviously the expectation is that you're an active participant in your recovery. It isn't a passive experience at all. So one of the first things they gave me was this gizmo here, which is a spirometer, and the purpose of this, it's an exercise machine to get your lungs working, to get you to breathe deeper in your lungs, and also with the exercises that they have you performing, to clear your chest of any phlegm or anything that you need to get rid of, to keep your lungs clear. The last thing they want is for you to have a chest infection. So this is basically you just suck on it, and the float goes up, and then you perform several of these, and then the huffing, what they call huffing and coughing exercises. So you do several of those, and then there's this exercise, what they call huffing, which is like you're breathing on a window, and then coughing, just to loosen anything that's on your chest. So the day went very quickly. I drifted in and out of sleep all day. I was helped eventually back into bed in the late afternoon, and after eating both my lunch and my dinner, obviously the sickness had passed by this point. Then on to the 23rd of October, which was the Monday, I was pretty much the same as Sunday. However, they did let me know that they were going to look at moving me to the normal ward, moving me off the ICU. So I was seen again by the physio. This time they had me out of the chair, had me walking a few steps on the spot. They couldn't take me for a walk because I was still attached to all of the monitoring equipment. I had a drain in me which was attached to the to a plastic catch tank for the fluids, and I also had a catheter in for my urine. So had me doing some exercises, some of the spirometry and breathing exercises, and it went quite well. So sometime around the middle of the afternoon, one of the nursing staff came and took the drain out of my chest. So the drain that goes in your chest, it's a perforated tube. It goes in the chest cavity down here, comes out just below where they make the incision, and that basically drains any fluids after they've stitched you up. So if there's any blood or fluids collecting, it drains those out, so the area's kept clear. That was taken out. I was told it would be an uncomfortable experience, and it wasn't really. It was they cut the stitches, give it a quick tug. After explaining they wanted me to hold my breath and how to do it, they give it a quick tug. It pulled out. It was over in seconds. They put a stitch in it, and that was it. That was I guess the first significant milestone was having that drain taken out. And then later that afternoon, I was taken down to the ward. The nurse there who worked on the ward ran through what would happen over the next few days, what was going to happen in terms of pain medication, because they'd taken me off the really strong painkillers and they were moving me over to paracetamol and codeine as the main pain relief. So they explained that. They explained how the monitoring would work, because when you're on the ICU, the monitoring is permanent. You've got lines in that do your blood pressure. You've got a line for your oxygen saturation. So they're constantly monitoring your pulse with the pads attached to all over your body. They're constantly monitoring your BP, and they're constantly monitoring your oxygen saturation to make sure everything's okay. So yeah, I wasn't on that. It was going to be every 4 hours they would come and do the what they call observations manually. So that's what they moved on to. I did have the heart rate monitoring constantly. That's the only thing I did have. And then we go to the 24th of October, which was a Tuesday, and very early in the morning the nurse came and she removed the urine catheter, and which was a big relief to have that gone. Yeah, so the urine catheter was removed, but I didn't immediately go to the toilet because my bladder was empty. As soon as any fluid's in there, it's basically gone. It goes straight goes into the bladder, straight out of the bladder, because it's open. It's effectively, the bladder is open. So when they take the catheter out, your bladder is completely empty. So it takes a little while for the fluids to build back up in the bladder, and the nurses there, they wanted to kickstart the process, so they gave me some water tablets. And after having my first pee, I must have gone to the toilet about three or four times in a matter of hours, and they were recording the amount of water I was passing in that first 24-hour period to make sure that everything down there was functioning as it should. At this point, I'd still not opened my bowels, but we'll come to that in a minute. So I was able at this point now to get out of bed. so I was able to get up, walk up and down the corridor a couple of times. And this was prior to the physio coming to see me. So when the physio come to see me, she says, have you actually been out of bed and had a walk yet? And I said, yeah, I've been. Walked down the corridor, and she was really chuffed with that. She said, well, we'll go for another walk now and see how you do. So we went for another short walk. She says, no, you're doing really, really well. So she was very happy with that. So pretty much the day was like a normal day on a ward. My meals came and went at regular intervals. The nurses came and did their obs. The medications came at regular intervals as well. And then we sort of hit Wednesday, 25th. So on the 25th, the physio came back and took me for a much longer walk. This time we went down a flight of stairs, and we did a loop, which took us to the next ward along, came up the stairwell to that ward, and then basically it was just like a little loop. And I was able to do that without any assistance. I walked down the stairs and up the stairs, and no help required. And she says, well, as far as she's concerned, she's happy to sign me off as being fit enough to be discharged at that point, and she didn't need to see me again. So that was good. So the doctors came to see me. They talked. They said, you know, they'd had a look at they'd had done an ECG on me. And they said they were really happy with the ECG they took. So if everything else checks out, they'd be looking to discharge me that day, which was the Wednesday. But I happened to mention to the doctor that I was having issues with my vision. And the issues were, you get those like little flashing lights and floaters in your eyes. I've been getting those. I'd had a bit of pain behind my eyeballs. It felt like someone was pressing on the back of my eyes. So I mentioned that to the doctor, and he said, oh, we better have a look at that. So they decided they were going to make an appointment for me at the eye hospital, but the earliest they could get was the next day. So they kept me in overnight again, and decided they were going to take me to the eye hospital, get it checked out, and subject to that, then they'd make a decision on whether they could discharge me or not. So the following day, which was Thursday the 26th, they got me up early, gave me breakfast a bit earlier, and they organised transport to take me to the eye hospital. A member of staff accompanied me there. They took me in my pyjamas in the ambulance to the other side of, oh, it's not the other side of Manchester, it's probably a good 30-minute drive from the hospital I was in to the hospital where the eye hospital is. So they took me to the eye hospital, and I was triaged first, and the doctor there saw me reasonably quickly. I think we were in and out in a couple of hours. And they examined the back of the eyes. They put dye in my eyeballs. They examined the back of the eyes, and they could see that there was no bleeding, no damage. All of the sort of parameters they look at with the eyes seemed to be normal. But they did say that it's not uncommon. It's not uncommon for people to have this issue because of the nature of the surgery. You know, you're on a lot of drugs. You put on a heart-lung machine, which is doing your heart and your breathing for you. So there are lots of things that can cause tiny little issues that over time will be okay. So anyway, they were satisfied that there was no damage, there was nothing wrong with the eyes intrinsically, and that it would just be a matter of time for them to recover from the operation. So anyway, they took me back to the hospital where I was staying. The doctors came to see me. They said they'd received the results from the eye hospital, and they'd reviewed all of my other information, including the last set of blood tests, which were you know, they're looking for markers for infection. They said everything looked good. and they're very happy with how I was progressing. So yeah, we're going to kick you out. You can go home now. You're going to have to look after yourself, but we've done as much here now that we can do in terms of your recovery. It's all in your hands now. So, which is fine. I mean, that's normal. And to be honest, I was relieved in a way to be able to be going so soon, because I expected I'd be in there for 10 days, 12 days, something like that. So to be leaving in under a week was, to me, says that I'm doing really well. So I take that as a pat on the back. So anyway, Thursday afternoon, my sister come to pick me up. Got back to my sister's, and so that's where I'm staying at the moment. I'm staying at my sister's, and I had an evening meal, a home cooked meal, which was really good. My dog Bronson, he was really chuffed to see me when I arrived, and I slept quite well. So when we're sort of Friday the 27th was the next day, which was yesterday. And that was a really, I won't say it was a backward step, because it wasn't. It was probably something I should have anticipated, but I had a bowel movement before they released me. They wouldn't have let me go if I hadn't. But it wasn't, how can I say this to be YouTube friendly? It wasn't the easiest bowel movement to part with. And I thought that the next bowel movement I would have would be a bit better. Well, it wasn't. It was. I ended up with a very bad situation that took hours and hours to resolve, and a lot of discomfort because of how difficult it was to try and pass this stool I had caught in my system. Yeah, I don't really want to go too much into it, but it was, let's just say it was, there was a jam in the system, and it was very uncomfortable. But I drank lots of water, took some more laxatives, and eventually I was able to clear the blockage. So one of the takeaways I would definitely tell people is don't. I think Thursday I might have neglected my hydration a little bit, because I'd spent all morning at the eye hospital and I hadn't been drinking very much. Normally I'd be drinking water all the time, and then when they told me I was being discharged, I drunk less then as well. So I think my hydration, the amount of hydration I was taking in on Thursday was insufficient. I should have carried on keeping my hydration up. So that's something that it's very important to maintain that, lots and lots of fluids in, because I'm on codeine, and codeine isn't as a pain relief isn't absorbed by the body easily, and takes a lot of water to flush it out of the system. So all the fluids that are taken in, the kidneys are taking that fluid to get rid of the codeine out of the body. So it's diverting water away from the bowels, because you need a certain amount of water in your bowels. It's diverting water away from there to get rid of the codeine. So anyway, that's what happened yesterday. So apart from that, everything is going well. Today, like I say, is the 28th of October, and today's been pretty normal. I've been doing the medications and doing my breathing exercises, and I'm feeling much better. I'm sleeping much better. So hopefully by the time I get round to doing my next update, which may be in about a week or so, I'll probably leave it another week, and then after that I'll probably do one as I reach each milestone in my recovery, like being able to go for a proper walk outside. Where I am at the moment, it's a 2-storey house, so I'm walking up and down stairs to use the bathroom. I'll do another video update in about a week once I start being able to do a few more things. Next week I've got an appointment back at the old hospital, which is just the first post-op review. So they'll want to take bloods, and they'll want to inspect the incision. They'll probably do another ECG, obviously listen to the heart and all that sort of stuff. So hopefully, all things being good next week, I can start looking at doing a little bit more in terms of the things that I can do, like going for slightly longer walks, more frequent walks, and building my fitness and stamina back, because even doing the smallest things at the moment, it is really tiring. I sleep quite well at night, but I'm finding that I get tired during the day as well, and I want to sleep. So and I guess that's normal. So hopefully over time that's going to pass. So that's where I am. That's where I'm up to with my post-op progress. I'll post any new updates as and when they happen. But until then, thank you very much for watching this video, and I'll speak to you again real soon. So thank you. Bye.